2010. My name's Chris Porche. I'm the Healthy Steps Program Manager. And our topic today is colorectal cancer. We'll be exploring some of the myths and facts about this disease. But before we get started, I'd like to go over a few housekeeping rules. The presentation will last about 20 minutes, and if you have any questions about this topic, feel free to email us at healthysteps@loveless.com. You can expect to hear back from us in about 48 hours. We won't be taking questions during the presentation, so if a question comes to mind, jot it down and email it to us. We do want your feedback about the presentation and to know how we can support you in the future. So please complete the evaluation you will receive via email after the presentation is over. Also, there's sometimes a delay in the slides or the audio may become scratchy. So if for some reason you get disconnected, just call back in. Okay, today what we'll cover is some general information about colorectal cancer. We'll review colorectal cancer screening options and recommendations. And there are risks to the screening, so I'll cover those as well. And finally, I'll let you know how to get more information on this topic. First, let's review a little of the anatomy, or what I like to call the Are You Smarter Than a Fifth Grader review. The colon and the rectum are parts of the body's digestive system. The digestive system removes and processes nutrients. That would be vitamins, minerals, carbohydrates, fats, and proteins, and water. All this comes from the foods we eat, and the digestive system helps pass the waste material out of the body after it has used those nutrients. The digestive system is made up of the mouth, the throat, the esophagus, the stomach, and the small and large intestines. The first 6 feet of the large intestine are called the large bowel, or colon. The last 6 inches are the rectum and the anal canal. Colorectal cancer is a disease in which malignant cells form in the tissues of the colon or the rectum. So cancer that begins in the colon is called colon cancer. And the cancer that begins in the rectum is called rectal cancer. Cancer that begins in either of these organs may also be called colorectal cancer. Sometimes doctors don't know where cancer started, and they may refer to a malignancy simply as colorectal cancer. In recent years, the number of people diagnosed with colorectal cancer has stayed about the same, but the number of people who die from colorectal cancer has decreased, and this is very good news. It's in large part due to the fact that more people are receiving screening. Anything that increases a person's chance of getting a disease is called a risk factor. Risk factors for colorectal cancer include the following. If you are 50 years of age or older, if you're male, if you have a personal history of colorectal cancer, or have had polyps in the colon or the rectum. Also, having cancer of the ovary, endometrium, or breast are considered risk factors. And if you've had ulcerative colitis or Crohn's disease. If your parent, brother, sister, or child has had colorectal cancer or polyps. And having certain hereditary conditions such as familial adenomatous polyposis and hereditary non-polyposis colon cancer. These are all considered significant risks. So, tests are used to screen for different types of cancer. Some screening tests are used because they have been shown to be helpful in both finding cancers early and in decreasing the chance of dying from these cancers. Other tests are used because they've been shown to find cancer in some people. However, it's not been proven in clinical trials that the use of these tests will indeed decrease the risks of dying from cancer. So a clinical trial is a type of research study that tests how well new medical approaches work in people. These studies test new methods of screening, of prevention, diagnosis, or treatment of a disease. Sometimes these trials are also called clinical studies. So the scientists studying screening tests to find those with the fewest risks and most benefits. Cancer screening trials are also meant to show whether early detection, in other words finding a cancer before it causes symptoms, actually decreases a person's chance of dying from the disease. For some types of cancer, finding and treating disease at an early stage may result in a better chance of recovery. Clinical trials that study screening methods are taking place in many parts of the world. Information about ongoing clinical trials is available from the National Cancer Institute's website. Studies show that screening for colorectal cancer helps decrease the numbers of deaths from the disease. And I think that's an important point to say again, so that the studies about screening for colorectal cancer has been proven to help decrease the number of deaths from that disease. And there are 4 tests commonly recommended now, although depending on the organization who follows these studies and recommendations, these may vary just a little bit. But let's review the 4 tests now. So the first is the fecal occult blood tests, sometimes called the FOBT. This is a test to check for blood in the stool that can only be seen with a microscope. Small samples of stool are collected on 3 consecutive days, placed on special cards, and returned to the doctor or the laboratory for testing. So blood in the stool may be a sign of polyps or of cancer. This test is done annually. Sigmoidoscopy is a procedure that looks inside the rectum and the sigmoid, or the lower part of the colon, for polyps, abnormal areas, or cancer. A sigmoidoscope is inserted through the rectum into the sigmoid colon. A sigmoidoscope is a thin, tube-like instrument with a light and a lens for viewing. It may also have a tool to remove polyps or tissue samples, which are checked under a microscope for signs of cancer. A sigmoidoscopy and a digital rectal exam may be used together to screen for colon cancer. A digital rectal exam is not a recommended screening method by itself. So, this test, the sigmoidoscopy, is done every 5 years. A barium enema is a series of x-rays of the lower gastrointestinal tract. A liquid that contains barium, which is a silver-white metallic compound, is put into the rectum. The barium coats the lower gastrointestinal tract and x-rays are taken. This is sometimes also known as a GI series. And this test is done every 5 years. And finally, a colonoscopy, which is the gold standard for testing for colorectal cancer. Like a sigmoidoscope, or rather like a sigmoidoscopy, it's a procedure that looks